If you're coming back from an ACL or other serious knee injury, the place you need to start before worrying about anything else is maximizing blood flow to the joint. Now, there are several different ways to do this, and the one that is best suited to you is going to depend on where you're at in the recovery process. And so we'll dive into each of those techniques in a second. But no matter where you're starting from, the principle of trying to pull as much blood flow and circulation into the joint, into the injured area as possible, stays the same. The reason for that is quite simple. The body needs blood flow in order to heal and repair itself. It needs fluid and circulation to bring in fresh nutrients, build new tissue, clear out the old dead tissue, and be able to remove the swelling that's built up as a damage response to getting injured in the first place. The more we can work with the body to facilitate this natural healing process instead of fighting it, the better our recovery is going to go. This is why the classic advice of rest, ice, compression, elevation, or RICE as it's more commonly known, as well as reliance on anti-inflammatories, is no longer believed to be the best solution to dealing with ACL and other serious knee injuries. The problem is that every piece of that protocol is actually going to reduce blood flow and circulation to the joint, meaning it's going to slow down our body's natural healing process. Now, this protocol can be useful for dealing with pain, as it's going to reduce sensitivity and sensation, but in terms of healing, it's going to have the opposite effect of what we're looking for. So we know we want to maximize blood flow and circulation as much as possible to promote healing, but how do we actually do that? The simple answer is to move it as much as possible. If keeping it still and cold are going to have the opposite effect of what we're looking for, then keeping it warm and moving are going to have a much more positive effect and start moving us down that road to recovery. This is where the famous expression movement is medicine comes from, or if you don't use it, you lose it. Now, these expressions are a bit cliche, but they are still true. The more we can get the injured area moving and active as much as possible, the better off we're going to be, the faster we're going to heal. Now, the big caveat here, the asterisk behind the prescription, is that we have to meet the body where it's at. You don't want to go cranking on the knee 3 days after surgery because Zach told you have to move more. You have to work at your current level or ability. That's why we mentioned having the different options at the beginning of this video. The trick is to find a level that's challenging but not aggravating. Hard, but not hurting. This is an art as much as a science. Now, me being a lowly strength coach and personal trainer, not a PT or physio, I don't work with people immediately off of surgery. I work with athletes that have a few months of rehab under their belt, that are up and walking around comfortably and ready to take things to the next level. So keep that in mind as we go through these various tools and recommendations for you to use. If you're much earlier in the process, lean on your physio, lean on your doctor. Tools like e-stem and that sort of thing will have similar effects, but be less invasive, less challenging than the ones that we're going to go through now. And remember why we're doing this. The goal of each of these exercises, each of these variations, to get as much blood flow, as much circulation to the joint as possible to help it feel better, to help promote that natural healing response. An easier way to think about it, rather than talking about circulation and blood flow all day, which may or may not actually mean anything to you, you can think about it bodybuilding terms, so trying to get a pump. The more we can get the muscles around the joint active, the more we can feel things working. These are the sensations that we're looking for when we're going through any of these exercise variations. So let's dive into it. So if you followed my content for any length of time, you know I'm obsessed with backwards sledding as the first point of entry to deal with these major knee injuries. This is how I start every single session of my athletes in the gym and in my remote coaching program. There is absolutely no better tool for bringing blood flow and circulation into the knees and into the quads and getting an amazing pump even at fairly early stages of the recovery process. The reason that I rely on this tool so heavily is two-part. First is the intensity. There are few, if any, tools out there that are going to get as much blood flow, as much of a burn, lactic acid buildup to the knees and to the quads as the sled. It's going to absolutely kick your butt, but in the best way possible, providing a positive stress that forces the body to adapt, get stronger, heal, and recover. But it's not just the intensity. There are a lot of tools out there that can get a good burn, get good work to the quads. The second and perhaps most important aspect of why we use the sled so much is because of how gentle it is on the joint itself. This means you can push and work the muscles hard while being confident you're not overloading and stressing the joint and the connective tissue itself. This makes it the perfect tool for athletes coming off of ACL and other knee injuries where we know we want a positive stress, but we need to be careful in how we apply that stress. The trick or the science behind this works is because sled training applies stress or load to the body in a form of training known as concentric-only training. In nerdy science terms, the concentric portion of a movement is the part where you're actively pushing. Think about standing up in a squat. The eccentric portion is where you're lowering or resisting the way down. Think the descending in a squat. What's interesting is that the eccentric portion of the movement causes more damage to the muscle and puts more load into the joint itself. When pushing or pulling a sled, however, there is no resistance during that eccentric portion of a movement. Think about the backwards sled. When you go to take that step backwards, there's no resistance. It's only when you put your foot in the ground and push forward that you feel the resistance of the sled. This means we can effectively remove the portion of the movement that would put the most load or stress on the joint and the connective tissue while still maintaining the benefits of improved blood flow and circulation. Win-win. Now, if you don't have access to a sled, it really is worth going to the trouble to find a gym around you that has one, or even makeshifting your own. But if that's still not possible, we do have a few options for you. The best is getting on a treadmill, leaving it turned off, facing backwards, and starting to get that backwards motion using the internal resistance of the treadmill to provide a little bit of resistance, a little bit of difficulty. The advantage of this over even some sled tracks is that you don't have to stop and turn it around, so you can get into a really nice rhythm and chase that pump, that blood flow, which is what this is all about. The other option is to simply go outside and go for a walk, but backwards. The loading is much gentler here, but using a hill can help replicate that feeling of resistance you get from the sled or the treadmill. But even just going through that movement for 10 minutes backwards can really help to get some fluid and lubrication to the joint itself. In terms of times and protocols, I tend to prefer duration over intensity, especially at first. So doing just one set of 5, even up to 10 minutes, starting slowly and allowing yourself to gently build into it, I find to be fantastic. Then that last minute or two, if it's feeling good, this is where you can push the intensity a little bit if you're a little bit farther along and looking for more of a challenge. But it's the repetition of this daily, yes, daily, that has been the most effective and important entry point that I have found for athletes coming off of ACL and other knee injuries. Remember, everything that we're doing here to try and work with the body and speed up that natural healing process. So be gentle, don't force things, work with your body at its current capabilities, but be consistent and you'll see big improvements in your recovery over time. If you found this video helpful, like, comment, share it with a friend. If you're looking for more direct guidance on how to get through your own personal recovery, check out our ACL Return to Sport program. And be sure to follow and subscribe for more content on how to build the strongest, healthiest knees of your life. Until next time, bye.